How common is attention deficit hyperactivity disorder in adults? Attention deficit hyperactivity disorder in adults is an interesting subject. Attention deficit hyperactivity disorder stands for attention deficit hyperactivity disorder, and it's often discussed in terms of how it impacts learning in children. In truth, adult attention deficit hyperactivity disorder merely means a continuation of childhood attention deficit hyperactivity disorder. In almost all cases, this condition was present in childhood, even if it wasn't diagnosed. Determining whether childhood attention deficit hyperactivity disorder existed is one of the main tests for diagnosing the condition in adulthood. When people read statistical evidence about attention deficit hyperactivity disorder in adults, it can become confusing quickly. This is in part because surveys on who has this condition are not total, and diagnosis rate can vary by country. A lot of percentages are used to suggest prevalence. Some suggest about 3-5% of children have this learning disorder, and that 60-65% will continue to have the disorder as adults. But prevalence in the adult population according to studies by the World Health Organization is cited as approximately 4%, which doesn't make sense from a mathematical perspective. A lower statistic of 2-3% might be more accurate. Even if only 1 in 100 adults suffer from this condition, there are problems associated with it, unique to the adult. A higher rate of drug and alcohol abuse is seen with this condition, especially if it has always been undiagnosed. Job loss is greater, as is lower socioeconomic status, less education, poor relationships, and prevalence of other mental health issues such as depression and anxiety. These are most often felt when attention deficit hyperactivity disorder diagnosis was not reached in childhood because of the cumulative damaging effect of being different from peers and unsupported in the educational environment. This may be changing, and an unusual fact regarding attention deficit hyperactivity disorder in adults is that children are likely to be overdiagnosed for the condition while adults are underdiagnosed. This clearly suggests that many children are getting the diagnosis they need, and will hopefully continue treatment for this condition as adults if needed. On the other hand, it also means there is an accurate diagnosis too, and some kids and adults will be labeled or diagnosed with a condition they don't have. However, greater attention to diagnosis in childhood could in the next few generations have a positive effect on adults, and leave fewer of them undiagnosed. Information about attention deficit hyperactivity disorder in adults is continually evolving. It's quite possible that percentages may go up or down in the coming years. For now, it is important to recall that this condition can be seen as a common one in adulthood, probably affecting at least 1 in 100 adults, and possibly affecting many more.